Who's doing their report from NATO?
I don't know. We'll see. We will see.
I know, right?
Seriously. I don't see. You're doing a report today, I understand.
No. Yeah.
Says you're doing it. So there you go. There you go. Exactly right. That usually starts getting everybody to be quiet.
Are you ready?
Yeah.
Good afternoon. We will call the April PeADD board meeting to order. And at this time, we ask Jamie Smith to lead us in the pledge, followed by Lee Wilson with our invocation. I pledge allegiance to the flag of the United States of America, Thank you, Jamie and Lee. In your packet, you will find a copy of the minutes from February, and they were also previously emailed out. So if we could get, thank you so much. Thank you. We've got a motion and a second. All in favor? Any opposed? Motion carries. Next, we have our financial report given by Mayor Kevin Cotton.
I think the
I think
it
the
is. It's all
microphone
right.
was working. You want to repeat that?
No. Carry on later.
Listen, you all already know this, but the finance team here does a fantastic job. We should be at 75% of the budget, and we're currently at 51.93%. So let's give them a big round of applause for the hard work that they're doing. We appreciate that. We are in really good shape. We anticipate seeing that moving forward. There is going to be a couple of discussion points, I think, that Jason's going to bring up here in just a few minutes. They're very minor in the finances, but great job. Any questions? You can direct them to the finance team. With that being said, I make a motion to approve the financials.
Okay, thank you. All right, thank you. All those in favor? Any opposed? Motion carries. Next, we'll move into our federal and state reports. We have Morgan Alvey with Senator Mitch McConnell's office.
Good afternoon, everyone. I don't have much of a legislative update since the Senate is in the middle of a 2-week recess. They will be back next week. But I really just want to say thank you to everyone who reached out. I know I heard from so many of you after the senator's fall. He's doing much better, but I just wanted to say that he's appreciated all of the messages and check-ins. So we really appreciate it. And I know he's looking forward to there. Just a couple of other things that I would note. I know that the senator, along with the federal delegation, sent a support letter on behalf of Governor Beshear's request for a major disaster declaration stemming from the March 3rd severe weather events, which I know impacted several of our Penny Royal counties. And then also just finally note that we continue to keep for the Fort Campbell community in our thoughts and prayers following the loss of 9 lives in that helicopter crash. As always, if there's ever anything that our office can be of assistance with, please don't hesitate to reach out. Thank you.
Thank you, Morgan. And with Congressman Comer's office, we have Corey Elder.
Hello, everyone. It's great to be here with you on behalf of Congressman Comer. As Morgan said, Congressman Comer also signed on to letters regarding the February and March storms with the entire Kentucky federal delegation to bring some federal assistance down this way to help the communities. For the legislative side, Congressman Comer is working on a few things to lower prescription drug costs. He's working with several members of Congress on reforming some of the ways that PBM's pharmacy benefit managers work and how they overcharge the consumers and how that will help local pharmacies and really lower the price for prescription drugs in general. From the Oversight Committee, he's still looking into COVID era funds and how some of that spending is definitely not justified especially when it comes to, it being taxpayer dollars and how many that received those did not need it and how it was spent. And so the Oversight Committee is looking into that, as well as Congressman Comer, through the Oversight Committee, is looking into bank records from the Biden family. It's been, an ongoing thing for a while now, and Congressman Comer has found several Russian or Chinese deposits going into Biden family members' accounts. And so he recently subpoenaed for those bank accounts, just to bring some transparency and accountability back into the to the executive branch. Appreciate you all having me here. One last thing, I know the Madisonville Fire Department has sent over several grant letters. If there's any of your fire departments or any of your grants that y'all are applying for at the federal level, please reach out. We'd be happy to write a letter of support. And you can reach out to me or Austin on that. Thank you very much.
Thank you, Corey. And we have Martha Jane King from Governor Beshear's office.
Good morning, everybody. Well, I'm gonna give Alex's report first. Where is Alex? Did he leave?
I guess that's why he wanted you to do this.
I guess that's why. So he wanted you all to know that Commissioner King and the Delta Regional Authority Chairman Dr. Corey Wiggins will be visiting West Kentucky tomorrow and Wednesday, 10 o'clock a.m. at the Pennyroyal Park tomorrow, followed by luncheon. They'll be in Fulton on Wednesday all day, including meetings with the USDA. So I'm sure all y'all are up to date on the Delta Regional Authority. They're a great group that provides a lot of service for the area. So there were a lot of bills the governor signed this week, and one to me was really notable was House Bill 9, which is going to be a hello. This is touchy, isn't it? You have to be right here. State is going to match grant money. It's going to be very important because there's been a lot of times
Change this out for you.
like they can't hear me without it. Hello. A lot of times we all could qualify for a federal grant, but we can't find the 20% match. So House Bill 9 will provide money to the county or the agency that needs it, and you'll be able to get that 20% match. So that's going to be a real game changer, especially for the rural areas where we don't have that tax base to handle that. So I understand it's going to be in the fiscal year 2024. So that was signed into law Thursday. The reason I'm looking around is I worked last Sunday and Friday with the governor, and I don't have a clue what day it is. House Bill 21 was signed, and it will give homeless and people who have been displaced because of tornadoes or floods a chance to get a Kentucky driver's license. And so that was a bill that had been worked on, I guess, since 2011 when I was in office. I remember that bill coming up. And it was approved by the legislature, and everybody thought it would be a real good idea considering all the issues that we've had in Kentucky, and to help those people in shelters and homeless people to get a driver's license. Representative Raymer has got House Bill 125, which is going to help the Department of Aging and local government by giving information on dementia. Alzheimer's. It's been proved that the more we know, there are things that we can do to keep people from having further issues, to take steps that help everyone. So the more we know, the more maybe we can help out to prevent our elderly, which is me now, from getting dementia and Alzheimer's. Sunday, I was in Hopkinsville with the Lieutenant Governor after the storms we had. And we toured downtown and toured one of the communities. And Judge, I think we just said there were 10 businesses affected and about 20 homes. And they were just so fortunate that nobody was killed. It was just amazing. A lieutenant governor went back and informed the governor, who flew down Friday. And again, we toured the same things, and Colonel Slinker was with the governor. And we sat down afterward and had a meeting, and I just told the judge that Colonel Slinker called me on the way here, and he is talking to the Baptist Association, who is a nonprofit, and they say they can come down and possibly take care of all the trees in an underprivileged area with a lot of seniors that don't have the ability to clean up. And so if they can get that to the road, the city's going to take care of it. And then the SBA said they would come down to see if the businesses would qualify for an SBA loan. So we do have some things in the works, and I was very proud of the job that was done in Hopkinsville. And according to, I guess, complications in Frankfurt, I ended up in Hopkinsville instead of Alex, who's sitting back there in the corner. And that's his district, but I was glad to go. Thank you.
Just, I think maybe some things had changed with the DRA visit tomorrow. Amy, am I correct? They are actually meeting at the Dawson Springs Community Center at 10 o'clock.
All right. Thank you, Martha Jane. Next, we have Josh Tubbs with TVA. Yep.
Josh, we didn't know if you wanted to make any comments or not. I always appreciate you being here with us.
Thank you for having me. I'll just introduce myself. Somewhat still in this position. Josh Tubbs with Tennessee Valley.
Thanks.
Maybe it's based in a picture, I don't know. Josh Stubbs at Tennessee Valley Authority. I'm doing government relations in the North region, which includes all of the Kentucky counties. So glad to be here. Thank you all for opening up and introducing me, and I appreciate it. Anything that I can do for you all, come chat with me after the meeting.
Thank you, Josh. And then we also have Charles Turner with RCND.
Charles, anything you want to?
Hopefully the next 2 months will give you the rest of it. And don't anybody in the room get nervous about the city here, I'm not gonna vote.
But you're also planning Water Week. Charles, you're also planning Water Week.
Yes, Water Week, we're looking at May the 6th and 13th. And we're having field trip to students out at Jefferson Bend. And we're going to incorporate a lot of water activities into May 27th, our annual Take Kids History. So we encourage everybody to, we'll get some information about Water Week.
Mhm.
Hopefully you can support your Take Kids History events.
Thank you.
Thank you. Next, we'll move on to our staff reports. And first up, we have Amy Frog with our Community and Economic Development.
Good afternoon. If you all would refer to your packets, there is a funding notice for the month of April and a few paper pages behind that funding notice. Excuse me. It's April and allergies are in full swing. What do I have to do to make this work, Tim? Chris? It is on. Okay, there we go. Okay, sorry about that. The first opportunity I want to talk to you all about, as Miss Martha Jane mentioned, Delta Regional Authority will be in the area this week. And they do currently have a funding opportunity that is available to the 8-state Mississippi Delta region. Their annual CDAP, that's the state's economic development program, and then their community infrastructure fund is available to cities, counties, and then nonprofit entities within our 9-county region. Eligible activities under the DRA, CDAP, and SIFT programs are basic public infrastructure. This is your water and sewer sewer facility needs, any electric or gas utility needs, GIS needs, broadband, and then solid waste landfills are also eligible as basic public infrastructure. Transportation infrastructure, including roadways, bridges, rails, port facilities, and then improvements at airports as well. Both the basic public infrastructure and transportation infrastructure programs do not require a match for those two applications, but it is highly encouraged that you do provide a match for those projects. Business development activities with an emphasis on entrepreneurship, business creation, business retention activities, and then business expansion activities. That does require a 10% match for those projects. And then workforce development activities, which includes any job training or employment-related education activities. And those programs do also require a 10% match as well. This year's 2023 CDAP allocation is just under $1.4 million. So that's about on par for what we've had. But all of the counties in the Purchase Area Development District, the Penny Ryle Area Development District, and then 7 counties in Green River Area Development District are the ones that are eligible in Kentucky for those funds. So that $1.4 million will go towards projects in Western Kentucky. The 2023 SIF allocation is around $30 million. Again, this money is for infrastructure projects only. The DRA application process is an online process. They do receive applications through their portal. Tier 1 applications, which are those projects that have a committed job creation as well as a match, will be considered for funding as they come in. Right now, we are waiting on the final NOFO to be released from DRA, but it's looking like the application deadline is going to be towards the end of June. While we're talking about DRA, again, Ms. Martha Jane mentioned that Chairman Wiggins is going to be in the region tomorrow. Again, that will be at 10 o'clock tomorrow, Tuesday, April the 11th at the Dawson Springs Community Center. That address is 108 West Keegan Street. If you do plan to attend, they did ask for RSVPs. So if you would like to go and have not RSVP'd, please let me know so I can give them a count on how many will be there. And the purpose of this meeting is just to have some staff available to hear your all's needs and how their programs may be able to help address the needs that you have. The second program that I want to talk about today is the Community Development Block Grant Program. There should be 2 full sheets regarding the DRA and CDBG programs in your packets that go into a little bit more detail there. So we're just going to hit the highlights. The 2023 allocation for the state of Kentucky is over $25.7 million. And you can see the breakdown amongst the various categories in those projects, what they have available for those type of projects. Any CDBG project must meet what they call a national objective, and that is either to benefit 51% or more low to moderate income persons. It goes towards the prevention of elimination of slum and blight, or to meet an urgent community development need, such as disaster recovery. These are the thresholds on what you can apply for under each of those categories. For community projects, and those are projects such as improvements to your health departments, volunteer fire departments. We've done several projects throughout the region under this. We currently have some applications in for ADA improvements to public facilities like libraries and things of that nature. The threshold for that category is $750,000 with a minimum of a 10% match there. For economic development related projects, the maximum for those applications is $1 million. Similarly, housing projects, the threshold there is $1 million. For public facilities projects this year, they have raised the thresholds, which will help greatly in the implementation of those projects since costs have continued to go up with those projects. For water or wastewater treatment plants, you can apply for $1.5 million, which is $500,000 more than it traditionally has been. And then for your line pump, meter, and tank projects, they've increased that threshold $250,000 to $1.25 million threshold. Public services category, which is the Recovery Kentucky centers that are the rehab facilities that are scattered throughout the state. They can still apply for $200,000 annually to help with their operation expenses for those facilities. Application deadlines come in groups with the CDBG program. For community projects and public facilities projects, that deadline will be September 1st of this year. And then for all of the other categories, housing, economic development, SURF, and public services, that application deadline will be January 31st of 2024. I will let you all know that these applications do require quite some time to put together. So the quicker we start those, if you have projects that you might be interested in, the sooner the better. And then just some dates to remember. Again, most of these dates are located within that funding notice for April. Rubber modified asphalt grants are due May the 1st. COPS hiring program, which are federal funds to hire some additional police officers. If you have those needs, those applications are due May the 4th. The Homeland Security Grant Program is due May the 5th. Again, our Recreational Trails and Land and Water Conservation Fund applications are due May the 31st. And Angela Herndon sent out an email, I think, to most of you judges last week regarding the Charging and Fueling Infrastructure Discretionary Grant Program. And this is basically for your EV charging stations. Those applications are due May 31st. We are looking at a regional approach to this. Since this is a nationwide grant opportunity, we felt that may be the best approach, is if we attack this from a regional perspective. And if you're interested in participating in that regional approach, we need you all to get your information to Miss Angela by May the 15th. Also in your packet is your intergovernmental review or clearinghouse report. We had 8 projects that were submitted for review during the last month. If you all would care to take a look at those, and if you have any comments on any of those projects, please get that information to us and we will pass that along. Any questions? Great, thank you.
Thank you, Amy. Next, with the West Kentucky Workforce Board, we have Sheila Clark.
I'm going to defer my time to Tom Solar because he has more news to tell you about.
All right, thank you, Sheila. Tom?
Thank you, Sheila. Good afternoon, board. I have a few dates I want to put out in front of you just to make you aware of. First of all, there's a youth committee meeting for those that might be interested in it. It will be April 19th at 1:30 here at the PeADD office. This will be an informational meeting and best practices discussion in order to prepare for next year's funding. So if you have anybody that's going to be interested in that, needs to know about it. Again, it's April 19th at 1:30 here at the PeADD office. A couple other events I want to bring to your attention revolves around some job fairs and hiring events. And you'll hear here in a few minutes why these are needed. But the first one I'll call your attention to is going to be Thursday, April 20th at Tree County. And these 3 job fairs I'm going to mention are pertaining mainly to high school students, students that are particularly seniors that are graduating high school. If you notice these dates, they coincide to where they're 2 to 3 weeks out prior to their graduation. These will be targeted to students that have been sort of predetermined, that are not going to a 4-year institution, or they're not going into the military, but they're going to be going into the workforce. So the first one will be April 20th in Tree County at The Way, which is at Lafayette Street. It's being coordinated in conjunction with our office and our staff, but also Beth Sumner there to Chamber of Commerce and Katie's. This is the second annual one. Last year's was very successful and we hope this will be too. The second one I want to draw your attention to is April 27th. It'll be here in Hopkinsville. It'll be at the Sportsplex. Again, this is the second annual one for this one. Again, it's designed for what I just mentioned, students that'll be graduating like 2 or 3 weeks right after event is held. I know last year, both these events, I was at these events, there were actual individuals that were hired that day and started right after they graduated, right after they walked the line. They went straight into manufacturing positions and other positions, but mainly manufacturing positions in our local area. And that's what these events are designed to do. It will be held from 9 to 1 again at the Sportsplex. And this is being coordinated in conjunction with Southwest Economic EDC and our office and our staff. And the third one I'll bring your attention to will be held in Crittenden County at the Rocket Arena there at Crittenden County High School on May 2nd. And again, it's pretty much designed the same thing. It's aimed at students to be graduating from high school. It will be from 10 to 3 for students. And then after that, it will be opened up to the public. So anyone from the general public wants to come to attend, they can be searching for jobs too. I'm not sure how many companies and businesses are signed up for each one of them. I do know the one here in Hopkinsville currently has 22 businesses signed up. Mainly it's manufacturing, but there's other businesses signed up also. I have not talked to Beth lately in Trigg County to find out her number. So just want to bring you up to date on that. The other part of my report is dealing with economic development. I guess most of you have heard recently the 2 big announcements here in Hopkinsville and Christian County, the 2 big manufacturing facilities that will be employing over 700 people. That's the reason for these job fairs. And the West Kentucky workforce is proud to be part of this economic development. Carter Hendricks with Southwest Economic Development is going to give you a quick update here in a minute on these numbers, but he allows us to be at the table when we meet with these companies and even follow-up visits when they come back, and either we have a conference call with them or, as an example, one is going to be coming back later on this week to follow up details on their recent announcement as far as getting a timeline for their hiring practices. So Carter, I'll let you take it away. And not only just in Hopkinsville, the 2, but I think he's going to give you a quick update also on Todd County and Trigg County and recent developments there.
Thank you, Tom and Jason, for the invitation to give you a short update. I want to stress that I said I could keep this short because at 5'8", I can keep that promise. Brief, on the other hand, I'm not so certain about. No, I'm kidding, of course. I've got 2 Post-it notes, so I can keep this very short. But in the spirit of regional partnership, I jumped at the opportunity to come and give a quick update on behalf of the Southwest Kentucky Economic Development Council and the announcements. We do work very closely with the Pennyroyal Area Development District, and we're very proud of our partnership with PeADD and the West Workforce Investment Board. Can you guys hear me okay? Okay, good. So we were very proud of our partnership with West Kentucky Workforce Board and PeADD. And I kind of made a facial expression in the back when Tom said that we allow them to be at the table. We are dependent upon our relationship with PeADD and the West Kentucky Workforce Investment Board. And so thank you for the chance just to share in some of the great news on behalf of Western Kentucky. We're also very proud to be part of the Kentucky Cornerstone Partnership. Amanda Davenport here is a key leader, I think, gave an update about that not that long ago. So we're a proud member of that as well, because we believe in regionalism and we believe in helping promote economic development throughout all of Western Kentucky. Of course, I get paid to focus on the 3-county region of Southwestern Kentucky, Todd, Trigg, and Christian County. But let's be clear. If we have and when we have an announcement in any one of those 3 counties, it will benefit and impact the entire region around it. And we know this because we do the research and we analyze who our workforce is. So whether that announcement be in Todd County, Christian County, or Trigg County, about 40 to 50% of the workforce is going to come from outside of that specific county. Maybe Hopkins, Caldwell, Muhlenberg, Livingston, Logan, it varies, but usually speaking, a good announcement in Todd, Trigg, and Christian County is going to be a good announcement for all of Western Kentucky. So I'm going to give you 4 examples of announcements over the last year that we think will have significant opportunity for all of our region. Last March of 2022, Novellis announced its 2nd location in Guthrie, South Todd County, Kentucky, another $350 million investment, another 150 jobs. Last August, Ascend Elements announced, and it's actually been revised, so I'll give the revised announcement, a $1 billion announcement and 450 jobs in Hopkinsville's Commerce Park 2. They're the first industry to open up this new industrial park. And as we thought then, we figured there'd be more coming quickly. And recently, here in March of 2023, we had another announcement of Microvast, a $505 million capital investment, 560 jobs locating in Hopkinsville's Commerce Park 2. And then on that same day, Toyota Bushuku, another industry announced here in the Hopkinsville region with a $220 million capital investment and 160 jobs. Collectively, that's roughly $2 billion of capital investment and just over 1,300 jobs announced in this 3-county Southwest Kentucky region that will benefit all of Western Kentucky. And we're very excited about those opportunities, and we recognize that there's even more to come. So in the spirit of a good infomercial, but wait, there's more. Come on, somebody give me one laugh. Can I get Martha Jane? Come on, give me a chuckle. So something, I worked hard at that. If you take the total indirect impact, the multiplying effect of these $2 billion worth of projects, that's $11 billion of economic activity that I assure you, subcontractors, general contractors, small businesses all throughout Western Kentucky have an opportunity to compete and win that $11 billion worth of indirect economic impact from just those 4 announcements. Over 300 engineers are needed throughout this region as a result of those 4 announcements and one more, an announcement in Clarksville not that long ago called LG Solutions. 300 engineers throughout this region are going to be required in just these 5 announcements alone. We're fortunate to have great engineering programs throughout Western Kentucky, and specifically our programs at Murray State University, at Paducah Community College, technical programs at HCC and at Western Kentucky University. So 300 engineers are going to be needed just in these announcements alone. The average wages that we're seeing from these announcements are over $24 an hour, average entry-level wages. So we will see wage opportunities continue to increase. And these opportunities that Tom talked about for the high school students, they're not walking into $14, $15 an hour job opportunities. They're walking into $20, $25, $30 per hour straight out of high school job opportunities. Not just these announcements, but all throughout Western Kentucky as a result of these types of announcements. So again, very, very big impact. If you take a 200-mile step back radius, 200-mile radius from where we're currently setting, in the last 24 months, there have been over $17 billion worth of economic development projects announced in electric vehicle manufacturing alone. $17 billion. That means every one of your subcontractors, every one of your contractors, every one of your small businesses that's got anything to do with construction has $17 billion worth of opportunity in EV manufacturing alone. 15,000 new jobs. If Western Kentucky has ever had an opportunity, the time is now. So we're excited. We've got 2 spec buildings, one that's built, ready to be bought, and one that's under construction. I know Amanda, I know Josh, there's others throughout the region. Now is the time as regional leaders to keep investing in your community, keep taking advantage of these grants that Amy talked about, and making sure that you're dreaming big, because quite frankly, we are in uncharted territory when it comes to economic development. At least in Southwestern Kentucky we are, but by virtue, I think all of Western Kentucky, and especially with the other announcements throughout Western Kentucky and throughout the state over the last couple of years, 17 billion, 15,000 in electric vehicle manufacturing alone. That doesn't include every other announcement you may have heard about. So I hope you guys are as excited as I am about the present and the future. There's certainly more to come. I know that Amanda and people like me and others throughout the region are working hard, but I can assure you that we cannot succeed without the support and continued leadership of our strategic partners. And I'd be remiss in not acknowledging that when we talk about announcements, that doesn't happen because of the work we do. We get to come be behind the microphone from time to time, but it's the partnerships with our utility partners, our counties, our cities, and so many others, workforce and education that we pull together. They help us make the proper pitch, but more importantly, they help us put together the right pieces to the puzzle so that when you have the companies, the success stories there to be made because you've already put the work in. So it's the counties, it's the cities, and it's our partners. So even though I'm here behind the microphone, I wanted to make sure to say thank you to those who've helped make this happen. So thanks.
Thank you, Tom and Carter. We'll move to new business, and we are happy to announce that we have no issues to report under our monthly code of ethics report. And then our guest speaker this month, we have Miss Venetia McGregor and Shannon Jackson with the UK Healthcare Program and the Kentucky Income Reinvestment Program. Thank you all. If you want to.
Y'all have got a whole crew over here, so whoever. We'll let you go with this microphone as long as it holds out on us. That's right. Technology, you have to love it.
That's right. Hi, my name is Shannon Jackson, and I'm the team lead for the Target 4 program for University of Kentucky Healthcare. And I'm the team lead for regions 2 and 3. And I think for this PeADD office that encompasses Muhlenberg, Todd Christian, and Hopkins. Part of this is my team, and this is Venetia McGregor.
Hi, my name is Venetia McGregor. I am the team lead for Region 1 of the Target 4 project. So I cover the purchase area, also PeADD district, which including Marshall County, Callaway County.
Now, as far as other staff here, this is Hope Mitchison. She is with the PeADD District Health Department area, and she is Venetia's staff in Region 1. I have Josh Bell here. He is Region 2 in Todd County. I have Amy Catrone here. She is a health educator here at the Christian County Health Department. Angel Vincent, she is also a health educator at the Christian County Health Department here locally. And I have Mikkel Harris, and she is one of my staff in Muhlenberg, covering Muhlenberg and Hopkins County.
So just to discuss a little bit about our program, the vision for this program is to enhance the health and well-being of the people of the Commonwealth of Kentucky. What has happened is we're seeing more increases of new cases of HIV and hepatitis C. And so the goal of this program also is to provide the education as well as addressing the high-risk behaviors. So our mission is to partner with local agencies in our area, as well as students and other people in the community who want to know more about ending the HIV epidemic, as well as identify with those providing linkage to care for those that are newly diagnosed or for individuals who are out of care. So that means that they know that they are HIV positive, but they have not received the resources to link to care. Next slide, please.
We're just going to take turns passing it back and forth. The purpose and goal of the program, the Health Resources and Services Administration, which what we refer to as HRSA, is a division under the U.S. Department of Health and Human Services, and HRSA is the one that administers the Ryan White HIV and AIDS program. This is the largest federal program focused on HIV. The Ryan White program funds HIV care and treatment services for low-income people with HIV. Many people who receive services through the Ryan White program are uninsured or underserved. HRSA awards Ryan White program grants to cities, states, counties, and community-based organizations to, number one, provide HIV medical care treatment and support services for people living with HIV, and two, to improve health outcomes and reduce the transmission of HIV. The Ryan White program legislation was first enacted in 1990 as the Ryan White Comprehensive AIDS Resources Emergency Act, or the CARE Act. It has been amended and reauthorized 4 times to accommodate new and emerging needs, such as increased emphasis on funding core medical services and changes in funding formulas.
The national goal is to end HIV. Sorry, really hate talking in front of people, so you just have to bear with me. With the national goal, we basically go out there and we put ourselves out in the community, trying to find outreach locations to get in front of people that have the potential to have HIV. So we do tons of outreach. I know here in Christian County, we are all over the place. We do the rehab centers, we do coffee connections. We go where people are that could potentially have HIV in an attempt to make sure that people know their status. The only way to increase awareness is to be out there. And the only way to have people aware of what they have is if we test them. And you know, we have so many resources available for people with HIV that, you know, but if they don't know and we don't get out there to tell them, then there's no real way to do it. The biggest thing we do is we go out and we test and we provide linkage to care. We have several programs in the area that, you know, that offer care to the community and to anyone with HIV. So we try to get out there. We try to make sure that people that are living with HIV have access to that care as well. You know, we do it, like I said, we go to many different places throughout the many different counties. We do outreach and from mobile units to brick and mortar facilities, anywhere that it will allow us to come and offer testing to anyone that thinks they might have needs.
All right, so all of that can be boiled down to the program which we specifically work for called Target 4 Project, which the 4 pillars of test, referral, link, and education. And all of that started with some things that happened behind the scenes, not necessarily in Kentucky. In Scott County, Indiana, in 2014, there was an outbreak of HIV that led the United States to do a study of what other counties with similar demographics were at risk for having a similar outbreak. And they did that study, listed the top 220 counties across the United States. And of those 220, a fourth of them reside in Kentucky. So there are 54 counties that the US saw as potentials for an outbreak like what happened in Scott County with nearly 300 people contracting HIV. And so as part of that, Target 4 was born to do outreach. Part of that includes SSPs, which have drastically increased since we started. There were 49 operational in the state in 44 counties before Target 4 got started, and that has grown to, you'll see here, very, very hard to read, but there are 81 operational SSPs in Kentucky right now. Most of those working with our program through UK Healthcare to ensure that they are staffed and people are getting linkage to care.
You want to do that? You got it. All right. Got this. All righty. So in our region that we're representing here today, Christian County has 2 hours of syringe exchange on Tuesdays from 1 to 3. And we currently, for the year 2022, seen 1,604 people. That's a large number. Now, for like the other counties, Hopkins County had seen 598, Muhlenberg had 446, Todd had 104. Of those, you know, unique participants, Christian County has 457 in the year 2022. It has grown considerably since the end of the year. And like I said, each of the counties has, you know, roughly around a little over 100. Todd County has 34. As far as HIV testing, I know here in Christian County, we've tested 1,154 people in 2022. You know, as far as in the SSP, we've been fortunate. You know, we've had a lot of people coming in and that are willing to put themselves out there to get that kind of service. So there is that. And then you want to change the slide. This is our, maybe. And this is our outreach for all of the counties that we cover here. Christian County, in 2021, we did 387 HIV tests and outreach. We had 2 positives. And like for myself, we tested 850 people last year during outreach events with 1 positive. So we've been trying, to consistently get out there and get information to people. Of all the counties, Christian County obviously has got the largest number of population. So we do have the larger numbers as far as, people being seen. As far as Hep C, we also have tested 172 our very first year with 12 positives. We do have a much larger population with Hep C than we do HIV currently that we're finding. And we are linking them to care and trying to get them into treatment so that they can have the services that they need to be healthy. Was it for me?
I think we've said before that the Target 4 program was built on the 4 pillars, which is early intervention services. I believe those are defined by HRSA. But the Target 4 project, the 4 pillars again are the targeted HIV testing, referral services, linkage to HIV care, and health education and risk reduction. The allowable activities are conducted to increase an individual's awareness of their HIV status and, if needed, facilitate access to the HIV care system using HIV testing referral services, health literacy and education, and linkage to care as a bridge to medical care, medication access, and treatment adherence. To ensure compliance with the early intervention services definition specific to the Ryan White HIV and AIDS Part B programs, services from the Target 4 program will include the following 4 components. This is just a little extra explanation of the 4 pillars. The targeted HIV testing to help the unaware learn of their status and receive referral to HIV care and treatment services if they are found to be HIV positive. Our team will continue to coordinate these testing services with other HIV prevention and testing programs to avoid duplication of efforts, and will work to ensure that HIV testing efforts will not supplant testing efforts paid for by other sources. The Target 4 team will provide referral services to improve HIV care and treatment services at key points of entry. We are to ensure access and linkage to HIV care and treatment services such as outpatient and ambulatory health services, medical case management, and substance use care. And finally, the Target 4 team will incorporate outreach services and health education and risk reduction related to HIV diagnoses in communities across the state. As you can see, Kentucky has 9 Ryan White programs all across the state. This is where we refer people that have tested positive for HIV. You can see there in Graves and Todd counties, they have people specific to their health department that provide HIV. They are HIV linkage navigators. So they provide the referral and assistance through those health departments that they could also get at some of these other places. But in those 2 counties, the clients are given a choice. So they can either go with Livewell, they can go with Graves County, or if they're in Todd County, they can go with the Todd County Health Department.
All right, with the Target 4 program, the big part of the job is linkage. We're trying to get out and meet people where they are, whether it's at an SSP program or just out in the community, just make sure we're available for them to test. And if we get it positive with our people, we try to get them referred to our services. The 2 services that we mainly use in these areas are Louisville out of Paducah and also Todd County, which is my health department where I work. Next slide. And when we're doing targeted testing, we're making sure we're just getting people who are fitting certain criteria. It can be certain people who are maybe inject drugs or people who have sex with men. It's just different criteria. Next slide. And this right here is just a map of just like all of our regions and us in regions 1 and 2. So.
We also wanted to provide you all with a look at kind of some state numbers. So this is the outcomes for 2021 and 2022 for all the state for HIV testing. You'll notice that we did increase the number of people that we tested through the program by 13,000, by more than 13,000 for the 2 years. And you'll see that we have seen some positives that were previously unknown, which is the whole point of the program. So we can't do what we do without your support. Next slide, please. And then also Hep C testing and linkage to care. You'll see that those numbers continue to be pretty steady as well. While the SSP number did drop a little bit, we saw increases in our walk-in testing and our overall number of people that we tested for hepatitis C. So all of this is done obviously with the support of the counties in which we work. And so we wanted to make sure that you guys knew what was going on. As a note, you have 3 flyers in front of you, one about HIV injection drug use and how those 2 are correlated, as well as what syringe services are and how they benefit having one in your county. In case you wanted to know kind of what the cost analysis of that is, as well as principles of harm reduction, which is a huge part of what we do in our everyday work.
I'll be covering the methods of transmission. A lot of what we do is also education as well. If we have a participant come into one of our outreach events or a walk-in test wherever we cover, we like to let them know about HIV and hepatitis C. There's a lot of stigma and false narratives as how you can contract both diseases, but with Hep C, it is strictly blood-to-blood contact. And with HIV, it is a number of other method of transmissions, including sexual intercourse. With Hep C, a lot of people also believe that they can give it to themselves if they are an injection drug user and like to share needles, or if they just use your needle once, they'll put it down, use it again, and then they all of a sudden think they have hepatitis C from that, which is not the case. You can only get that if you have contact blood to blood with somebody who is Hep C positive. Go to the next slide, please. And these are all the bodily fluids that we consider infectious as well. So we just like to educate people on that, including and up to all of these things that you see on your screen. And also, if there's anybody in the room that has not been tested, we always recommend, no matter your age or sexual preference, to come to get tested at least once in your life or both, just so you know.
So continuing on, just to give you a brief overview about hepatitis C and HIV and AIDS, it is for hepatitis C, it's the virus that attacks the liver. So as she stated before, it is through blood. So if someone is an injective drug user and they are sharing needles with someone who has hepatitis C, they can receive that. They will get that infection, put them in a higher risk. Also, we know there are a small percentage of individuals who can actually, with their immune system and their antibodies, can actually cure themselves of Hep C, but that is a small percentage. Even though there is no vaccine for hepatitis C, there is a cure. There are programs that agencies said we do refer them to get treatment. As long as they are being compliant on that treatment, they will get rid of that infection. Now with HIV, it is a virus that destroys the immune system over time. So that means that it attacks the immune system, confusing it to be a infection. So over time, it just replicates itself over time over the body. And that, of course, can transmit to others through sexual contact, fluids, as discussed before in the previous slide. Also, if they do not get any treatment of any kind for Hep C, if they do not get treatment, they'll have things such as cirrhosis of the liver. Also with HIV, if they do not get treatment, it will progress to AIDS, to where something as simple as a cold may take maybe a week or two, and but with AIDS, it may put you in a hospital. So it is important to get that early test, get that test for the detection. Next slide. So one thing that we always educate others is ways to preventing not just HIV, but other sexually transmitted infections. So that includes getting quarterly checks, or if you are in a doctor's office and you're getting your physical done, include that as part of your blood work to get testing done. Also, abstinence is number one. We always make sure that if you don't have sex at all, that is the number one way to do that. Or if you have a partner that is, if you and your partner in a monogamous relationship and do not have the infection, that is a way of preventing it as well. Wearing condoms or other contraceptives to protect yourself. And also if for those that are injecting drugs, they to not share with others. Next slide. Also, we have a medication that's out there, and I know probably you guys may have seen the commercials. It's called PrEP. It's called pre-exposure prophylaxis. So that means this is the medication that you would take to prevent you from getting HIV. Some people compare this to women who take birth control to prevent pregnancy. This is a similar concept. And so examples are Truvada and Descovy are some of our medications that are prescribed to individuals who are on this medication. In order for them to be on medication, when they get tested, they are HIV negative. They have to be HIV negative to take this medication. And then every 3 months, they get checked to ensure that they do not have the HIV infection. So there are doctors and other providers in the area that can prescribe this prescription. Next slide. And so we, as we stated before about education, we always talk to individuals about their history of what we feel are considered high risk. So if they're not protecting themselves, they are injecting drugs and are sharing needles and equipment and things like that. Those are things that we discuss with them as an eligibility to be part of PrEP. And so that is a discussion that we do have with them. We do not force it, but we do provide that information if they decide to move forward with that. Next slide. And this is our contact information. We do have our business cards as well. So for these are all of our contact for those that want any more information or want to do a partnership. And again, thank you so much for your time during this day. Are there any questions or comments? Okay, thank you so much.
Thank you so much. Okay, next we have our director's report.
We've covered a lot of information today, I believe. Thank you all for being here with us. I'll go quickly because I know we're about out of time. In your packet, you will find a revised budget. It looks like this. If you can see that, I would ask for you to get that if you could. Earlier today, the executive committee did review this information in detail. If you will flip or turn to the second page, which is our expenditure report, that's basically where the revisions are that we need to make. You will see those items identified there at the bottom along there next to their line item. If there are not any questions regarding these changes, I think they total combined about $9,600. So, Madam Chair, we will need a motion to approve these amendments.
Okay, can I get a motion? So, okay, in a second. All right, all those in favor? Any opposed? Okay, motion carries.
You all know we did not have a meeting last month, and that was due to the fact that a number of our board members participated in the NATO conference in DC. But our main objective while we were up there was to visit with our congressional staff. And we do have some slides that were put together with the photos. If you would turn down the volume on those slides, and we'll let our folks that attended to give us a little bit of an update. So I'll turn it over to those that attended if you'd like to provide an update. I don't care who goes first.
I will go first.
Look at him.
I found that I was the oldest in the group. All the little children were there. I would say that I was impressed with our group. They all spoke well and had good questions and good points to talk to all the staff of our elected people. I would also say, not surprising, that everybody in DC thinks highly of all this crew that works for them over here. Y'all must be paying them well, because they said all of our representatives in our area keep them well informed of our issues and do that. This wasn't part of the trip before. You didn't mention something significant happened to you, Bree. If you hadn't seen it, you need to go, or the pages where he proposed. It was an unusual spot, because it was a balcony of our leading senators' office. We used to do that. That wasn't part of my report. The other thing is, I would advise you, if you go to the NATO report to DC, take a coat with you, a heavy coat. I've been sick ever since I got back. That's because this group took me out and we stood on a metro train station with the 29-degree temperature and wind chill below that. And I hadn't got over it yet. So if you're gonna travel with you, go prepared.
Who wants to follow that one?
Just point of clarification, Michael was not standing on the platform. He's in the elevator. He's going up and down while we were waiting on the platform. But I will say that it was a privilege to be able to go. We did see a lot of fruit from that trip already before we even made it back home. There were phone calls that were being made in reference to some of the topics that we were discussing. So that was a very big positive, I feel like, for our region. It was very beneficial. We had a lot of excitement while we were on that trip. We had a good time. There are other photos, if anybody wants to stick around to see those. I brought my iPad.
Nobody wants to see this. Nobody.
I'm more than happy to share photos of anybody that would like to see those. They would not let me put those on the screen, so.
I mean, it was a good trip. I presented on behalf of Blind, Livingston, and Crittenden, for the Lower Cumberland erosion problem. Presented letters to all representatives, obviously except for Jeffrey, to try to get some help for the Lower Cumberland erosion. And then also trying to help the city of Eddyville to get the Corps to release the Port Authority Road to the city of Eddyville so it can be properly fixed and maintained. That is a major industrial area for the city of Eddyville and Lyon County. We had a great time, learned a lot of restaurants. Lee Wilson is a great tour guide. If you've never been, I'm sure he can give you a tour. And some people eat ice cream when it's negative 20 degrees outside. And try to stand by their feet to keep warm. But it, all in all, it was great.
We did work the time, I promise. But no, it was a good trip, and I appreciate every one of our board members that did attend. Mayor Cotton already mentioned, we have already seen fruits of our labor while we were there with at least 3 projects I know of there in Marion, over in Livingston County with a stabilization project along the Ohio River, and then in Muhlenberg County with a landfill project that they're working on. So these visits do make a difference. And so we'll be looking at doing this again next year. So if you are interested, we'll be talking about that more as we circle back around this time next year. So thank you all for the report, and thank you all for going. I did want to mention, yes, sir.
You go see this, and a lot of the staff in DC knew that you got a water system. You hadn't heard about PeADD yet. You need to be catching up on it. We talked about wetlands. Wetlands affect all of our region and definitions of wetlands. I think time may come in the near future. We may need to be more lobbying with our citizens.
Thank you. just want to draw your attention to a couple of items in our newsletter. First being on the second page, you will see introduction of a new staff member that we have, Jamie Rigney. Jamie, would you stand up? Jamie comes to us as a social services case manager and special projects assistant. She's been with us just over a month, I think, at this point. Of course, we didn't introduce her last month because we didn't have a meeting, but Jamie, welcome. Let's give her a round of applause. And then the last thing I want to bring your attention to, and I can't believe it's already time for our annual dinner. We're just a few months away from June, but our annual meeting will take place on Monday, June the 12th. That'll be the evening of Monday, June the 12th. So hopefully you all have that marked on your calendars. More formal invitations will be coming out in the very near future. Anybody have any questions for me or our staff? Well, thank you all for being here today. And as always, we appreciate the support you all provide for our agency and the leadership you all provide for the entire region. Thank you.
Thank you, Jason. If we have no other business. Motion to adjourn. All right. Thank you. We will see you next month.